Okay, Commissioner, we're now live. You're good to begin.
Good afternoon. This is Kevin Brown. I'm serving as the Interim Commissioner of Education for the Commonwealth of Kentucky. I want to welcome you to the Reopening Kentucky Schools, a virtual town hall for local Board of Education members. Thank you for joining us today. And if you're joining at a later time, because we will have this archived, thank you for watching. We're pleased to gather all local Board of Education members, or many of those that you can join. We do realize there are several board meetings going on tonight, and know that those individuals will be watching at a later time. I want to thank the Kentucky School Boards Association for helping us facilitate this webcast. Obviously, they maintain your contact information, and so they were very gracious to allow us to, or they sent on our behalf the link to this webcast. And we have Carrie Schelling, your Executive Director of KSBA, with us. I would like to turn it over to you, Carrie, to say a few words.
Well, thank you, Commissioner Brown, and thank you to the Kentucky Department of Education for making this opportunity available to our public school board members and to KSBA. Since March, our association has shared COVID-19 information and guidance coming out of the department and Frankfort, but for school board members to get it straight from the source is really special. Being part of this crucial conversation with state leadership acknowledges the important role that board members have in public education and recognizes the incredible investment of time and energy that they, along with their superintendents and staff, have put into every decision they've made since March, and they have certainly made some difficult ones. The 857 men and women that are elected by their communities to govern our school districts spend a lot of time listening, and I appreciate you giving them the chance tonight to not only listen, but to be heard through their questions. And I look forward to it being the first of many conversations as we all get through this together.
Carrie, thank you so much. As many of you know, before being interim commissioner, I was counsel at Jefferson County Schools. I will go back there on midnight, September 14th, when Dr. Glass arrives. I will be counsel again. I rely on KSBA in that role. Have always relied on KSBA for various reasons in my professional career. Most all of it has been related to education, but particularly in the role in Jefferson County. And we all know Eric and John and the entire team at KSBA. I want to thank you all for partners. Carrie, you were a little too modest. I don't think you went into detail the many meetings that you and Eric attend and you normally attend on behalf of members in Frankfort, but what you've been doing since the virus started, all the virtual meetings that have occurred, the education continuation task force. I haven't even tallied up all the meetings that you all attend, monitor, comment, representing your members, and you all do a great job. So I don't think I've thanked you for that, but want to thank you for the partnership. And I know the department, and as all K groups and organizations, we're all representing different aspects of the education community, but it's all for the same purpose. That doesn't mean we always agree, but it means we're all trying to row in the same direction, and it's always been a good partnership. So I want to thank you so much.
Welcome.
We have a full agenda tonight. We will conclude at 7:30. I want to be true to that because I know you may have other plans and have allotted this time. Most importantly, we will have the question and answer session at the end. The topics include, of course, the overview of the governor's recommendation on school reopening school that was made on Monday. We'll spend a large amount of time discussing that. We have Dr. White with us for a discussion from the public health perspective, that recommendation and other issues that will come up through questions. We also wanted to take the opportunity to give you some updates on other COVID-related general information and about some KDE communication items and how you can find news on our website related to COVID and general education issues, as well as an overview of the COVID-19 guidance documents on the department website. This is a part of the website that your superintendent and your teachers are already well aware of because they're utilizing it every day. You may also have already been there, but we want to make sure you know where that is and where all those documents are stored, and then also some pertinent information and up-to-date information on the career and technical education and how that's going to be delivered this next semester. And then, of course, question and answers. I'm told we have at least 25 questions submitted by you overnight and through today. We will do our best to answer all of them until 7:30. If we don't get everything answered by 7:30, we will certainly, and there may be some questions we have to flag if we don't know the answer here on the air, and then we will communicate and provide updates to KSBA. They can send out the remainder of the answers to those questions, and or we may update our Q&A document and send you that link. So a full agenda, we'll go ahead and get started. I want to first provide you an overview of the governor's recommendation. As you all know, the governor on Monday at his press conference made a recommendation that schools should be closed to in-person classes as a result of COVID-19 until September 28th. Have met personally with the governor numerous times during the COVID-19 crisis, as well as Dr. Stack, Dr. White, and others. And obviously a very hard decision, but one that is necessary. And I want to tell you why it is necessary. I'm going to go over the same reasons the governor has gone over with you in his press conference, maybe a little more detail in case you haven't heard that. But we all know that during this crisis, repetition, I think, is the key to learning some of this stuff. I'm also going to talk about what happens if your district does not follow the recommendation. I know many of you, and I think that we had several questions of similar nature submitted already regarding that. We'll go ahead and answer that. And then there are some things that we need you in your district to consider if you are not going to follow the recommendation. So I'm going to go over those, and then I will defer next to Dr. White, and she will correct any misinformation that I maybe have repeated related to public health. I'm trying to be a good student, and we've had a great working relationship with Dr. White. So first I want to just go over and the governor listed 4 main reasons that supports his recommendation that we not have in-person classes until September 28th. And I want to be very clear. I fully support the governor's recommendation. I've talked to him personally. I've seen it, I've looked in his eyes. I've seen the demeanor of Dr. Stack, the concern that they have because of what the data is telling them, and I fully support it. And I want you to be able to support it. But I also recognize, and I've had over 10 calls with school districts over the last few days to discuss this issue, and I also understand the concerns you have, the other things you are trying to take care of for school districts. I'm sorry, I was just passed a note. We didn't know if we would have a special guest or not, but before I proceed, I believe the Lieutenant Governor has joined us and would like to say hello. We didn't know that her schedule will allow this, but Lieutenant Governor, if you're on.
Yes, I am, Kevin. Thank you. I was able to pop on for the first part of this, and I just want to say thank you for everybody coming on, and I understand firsthand how difficult these decisions are. The decision that you are faced with right now is a tough one, and I just want to relay to you that I'm a mom, I'm a teacher, I'm a basketball coach, an assistant principal, and until this year have spent my entire career in public education. And I want to tell you that having worked with the governor as closely as I have over the last few months as we began our first term, I can promise you that every decision that he has made, it has been made based on medical experts' advice and guidance from the White House. And I can assure you that he is putting the safety and the health of our communities first. And I hope that that is recognized. And I hope that, through this, that we can learn to appreciate that and work together for the betterment of our community, because that's what we're all here to do. And so I want to thank you all for your service to your communities, and I want to thank you for being here tonight, and wish you luck, and you will be in my thoughts and prayers as you make this tough decision. moving forward. But I can promise you that, and you can rest assured that the governor and I have done this step by step, always putting the safety of our kids in the classrooms, the teachers that work with them every day, the staff in the schools, and all of their families first. So thank you all.
Lieutenant Governor, thank you so much. I also want to thank you for your guidance to me, and you've always been just a phone call, a text away as we've navigated these issues. We never thought we would have to, and I certainly never thought as an interim commissioner that I would have to deal with this. And I can attest that your motive has always been one to do the best thing for our public schools, and to make sure that the Commonwealth and the citizens are protected. I want to thank you for that and your assistance on behalf of school districts. The governor, as you all know, indicated 4 main reasons to support the recommendation. And the first one, and perhaps maybe the most important, is that we are seeing in the total number of cases on the rise in Kentucky. And that has been occurring over the last few weeks. If you watch the daily press conferences that are, of course, covered in your local media, 785 cases today. The positivity rate today is 5.67%. That's significant, and Dr. White can tell you why, but a positivity rate over 5% is of concern. And that indicates that we are possibly at the apex, or put another way, as the governor described it today, the disease burden in Kentucky is at an all-time high. And I think the governor has tried to explain and put in very many different words to try to get across the urgency of the matter. And he also has said that the COVID-19 is spreading in Kentucky. It's spreading significantly. That in consultation with the White House and public health, that some of these factors and the other 3 I'm about to mention are of concern at a state level, because some of these things are factors that were also present in some of the states that then saw a vast expansion of cases. And we've seen that in the South, particularly around the coast. That's why this is of concern. Similar concern was repeated by Dr. Burks when she came to Kentucky, and I was able several weeks ago to attend that conference. It was meeting in Frankfurt. It was very sobering to hear her. She came to Kentucky not to make political points. She came because of Kentucky was already at that point starting to see some of the factors go in the wrong direction, and she wanted to get to some states before we saw and could hopefully prevent what some other states like Florida, California, Arizona, Texas, and others have endured. The second factor is concern about who is getting the virus. In the last few days, you've heard the governor emphasize the number of children under 5 that are getting the virus. Today, unfortunately, he indicated that we have 6 school-age students positive today in the case numbers for today. These are students that would be obviously in school, public or private or otherwise, if we were to open classes or had open classes at this point. The problem, and obviously we're concerned anytime a child is sick, but we don't know the long-term implication when a child gets COVID. We also know that obviously we, as schools, we have children in our midst, and we also have staff in our schools that have conditions that make them more vulnerable, and that is a concern. And we, as I said, we do not know the long-term implications, and that's very concerning. Third, the experience in other states. We've all seen the news. We've seen information on social media about schools that opened in Georgia, particularly Cherokee County, Georgia, opened August 3rd. North Paulding School District or I believe it's Paulding County in Georgia as well. Over 900 students or staff related to one of those schools are in quarantine as a result of opening August 3rd. Some other indications from Louisiana that the governor gave today. And we all know, though, and we've seen the pictures, they were not social distancing and they were not using masks. We know that we would do better, or at least that's my expectation. And I think I know our superintendents and districts well enough to know that we would be masking. And we would hope that result in Kentucky would be different. But it is still, we must pay attention to what's going on in Georgia because it is still a school district that opened and they have not had good success. And fourth, we know we still have families going on vacation. We don't begrudge any family going on a vacation. We all know we need it. But either knowingly or not, many of them are going to places that have high amount of COVID-19 in the community. And due to contact tracing, we know that some of those trips are bringing that virus back to Kentucky. We know those trips are continuing. The governor several days ago used an example of a family that he knows that innocently enough went to a wedding out of state, I believe, and then there was a spread at that wedding. And so all of those factors are combining to have a point in time that it is the belief that it is not appropriate for us to start school during this time period. And so that is why the governor made the recommendation. You may be asking, well, what happens if my district doesn't follow the recommendation? It is a recommendation. The governor, when I talked to the governor, was very complimentary of local boards of education and the respect that he has for decision making. He also knows that with comes a lot of responsibility with the roles that you're in, and he respects that. But it is a recommendation. You've heard the governor say that. This means that you do have the choice to not follow the governor's recommendation. It saddens me that we do have districts, and I'm talking to many of them. I've talked to 9 or 10 so far, and I'm saying something that's public knowledge. Greene County will start some form of in-person classes on Monday, and that gives me a lot of concern because they will be among one of the first school districts or among the first group to go in early to mid-August. Along with the schools in Georgia and some other states, and that does give me concern. We had a very positive and non-confrontational call, as we're having with the districts that are indicating that they are thinking about not following the governor's order or have already made that decision. And the purpose of these calls is for us to discuss, go again over all of these reasons why we're making the recommendation. Provide some additional detail. We have Dr. White on those calls. And some of you watching may have probably been on some of those calls. Some of you watching will be on calls tomorrow that we're having. And it's to have a dialogue as a part of the education community. And I'm very upfront. I want the result of the call to be that they say, Kevin, we've heard you. We're going to think on this. And I would love to see a different outcome in that they would then follow the recommendation. However, I also know that in these calls, hearing that I don't dispute anything I've heard, very heartfelt concerns that we also share about serving the social emotional needs of students. We all agree it is not up for debate that non-traditional instruction is not as good as having students in person, because we know we can provide all of the array of services. We know that teachers can read body language, all of the things we all know, where nobody's disputing that. And in some sense, I think we're all correct. And I've said that when a superintendent very well explained what his district was thinking about, and I said, you're correct. But everything that Governor Beshear said and Dr. Stack said and Dr. White said about why we need to not have classes right now is also correct and accurate. And here we are. So I want you to know that this is a large concern. And I want you all to make sure you're making and thinking through this decision. I know you think through the decision. But again, what happens if my district chooses not to follow the recommendation? So let's just use Monday as an example. Greene County has announced they're going to go Monday. The department's not going to show up down there in the KDE enforcement squad and prevent Greene County from going to school on Monday. They're going to go. They're going to follow their Healthy at School plan. We want all districts to double down on implementing that plan if they are not going to abide by the recommendation. But our fear is that any district that chooses to start during this time period where we're recommending that you don't start, the chances for that you will successfully implement your reopening plan, no matter how good your plan is, and we've seen so many of these plans that are good, is not high. This is coming from Dr. Stack. This is coming from the governor. This is implied by conversations they've had with those at the federal level, that when you are trying to open in a high-risk environment, which a school district, just the nature of school is a higher risk environment, doing so in the situation of having an accelerated virus that we do right now makes the chances that you can successfully implement your plan very low. So let's pretend a district opens Monday. Let's say there was an outbreak on Tuesday or Wednesday. What's going to happen? We know that districts are going to, and I hope and I believe, because I know the superintendents, they would take action and they would stop school, and they would have to work with their health department to quarantine, and that would delay school. And the problem, though, is the magnitude of that. We know that even if we were to open September 28th, there will still be a risk of transmission. The problem is, if we open now, the fear is that there will be more transmission because of the state that we are in with the virus, for all the reasons I've already talked about. And so next I want to talk about, if a district decides not to follow the recommendation, there are several things that I am imploring you to do if you do not follow the recommendation. Number one, I need you to have a conversation with your local health department about a testing protocol for your staff and your students. We've not included testing protocols in any of our previous guidance. I don't believe we have. Folks will correct me, Dr. White, if I'm wrong when she speaks. However, if you are not going to abide by the guidance and you're opening in this time frame, it is essential that you pursue some type of a testing protocol with your local health department. There's been a trial of testing of school district employees in one district, and I can tell you that we support making that happen in other districts, as does the governor's office and public health. Next, you need to make sure you've had a conversation with your local council, and I'm sure you're already in contact with local council, your board council, about whether or not there are issues with your liability insurance carriers. I have heard today, this is anecdotal, but it's from a source that I trust, that there's at least one district that had a conversation with their liability carrier that if they open during this time period, there could be issues with coverage under their policy. I have not confirmed that, but that is of concern to me. And of course, I'm trained as an attorney, but I need you to have that conversation, if you haven't already, with your board counsel, and then the board counsel can facilitate that conversation or know what questions to ask based on your liability policy to your liability carrier. Most importantly, you have a healthy at school plan. If you're not going to follow the recommendation to hold off on in-person classes, your district must double down on implementing that healthy at school plan with fidelity, 100%. We know it's a school environment. We know there will be minutes or seconds that masks will come down or come off, but we have to follow the masking guidance, expectations. We have to temperature check everyone. We have to do the cleaning protocols. You're going to have to do them September 28th, but if you're going to open at a time when we're not recommending that you open, you've got to double down on it. In addition to that, when you are using the Healthy at School document, and board members, we will point to where that document is when Dr. Foster comes on. That's what we're calling the flagship document. There's about 18 guidance documents. So among the 18, you'll have a guidance document about school buses and sanitation, and you may have another one about cafeterias. But the flagship document is what I'm referring to, that developed in conjunction with public health. That's where the major requirements and expectations are about masking, social distancing, all of those things that you have to do in order to open school. And we need you to double down on that. But look, in that document, there are things called best practices. And we know that best practices often cannot be accomplished because of financial strain of a district, or maybe there are not enough personnel. However, again, if your district is going to open during this time frame through September 28th, I'm imploring upon you to please look at the best practices and see if any of those can be accomplished when you're in school. Also, there are going to be numerous other things you need to consider. By telling you these things, I'm not encouraging you to do this. I do not want you to open to in-person classes when it's not recommended to do so by public health, the governor, and the department. However, if you do, and we know that there are districts that are going to do it, you have to ask yourself other questions. Where are my teachers coming from? Many Kentucky districts, as we know, we have teachers coming from other places. They may not live in the community where they teach. Because you live in one community where you think COVID-19 is not a problem, you may be a neighbor to a district that you go for commerce and for other reasons, or where you're getting the majority of your employees. Those are all things. There are numerous other things you need to discuss. So, Dr. White, I think I've covered, and you need to correct me if I did a good job of explaining the reasoning behind the recommendation. And then I think you can take us a little deeper from the public health perspective.
Yes, thank you. I think you did a very good job. He did well on his midterm of public health, and I'm going to try to get him an honorary MPH. I have been on the calls with Commissioner Brown since probably May. Every week we talk with the superintendents as we've gone through this journey of how do we help to get kids back into face-to-face school. That's obviously a goal for all of us. So I'm just going to go, this is going to be very brief, so I hope it's not too brief. Many of you know this. We know that this is a new disease that's never happened before, so there is no one on the planet with immunity except for those who have been infected. We know it started in China. We know it spread to northern Italy, came to the East Coast, came from China to the West Coast in the Seattle area. We had our first case March the 6th in Kentucky, and the governor declared a state of emergency then. And then March the 13th, President Trump declared a national state of emergency. And with the modeling, with the way things happened in China, had nothing been done to try to mitigate this virus, to try to provide layers in our society to prevent this spread, it was predicted we would have 45,000 to 90,000 Kentuckians die. A very frightening number for everyone. So with no vaccine, no cure, and no effective treatment, next slide, please. We are dealing with the very basic public health tools that we've had for years, that we've used for other diseases before there was cure or treatment or vaccine. And these are the things that you've heard before: social distancing, cloth face coverings, screening for symptoms and checking temperatures, hygiene, hand and surface hygiene, and contact tracing. Next slide. So for those of you who have looked at the flagship document that the commissioner referred to, those are the big four things that we are interested in. Social distancing, that has to do with the fact that this is a respiratory virus that will spread with droplets that come out of our mouth and nose. So that's why keeping far away from people is important, so that you don't spread those droplets. The face coverings, the cloth face coverings that the governor mandated, will protect you from spreading your droplets to others, and it will also help to protect their respiratory droplets from getting on you. The more of those viral droplets that you are exposed to, that get up into the nasal passages, the higher the chance that you are going to have this virus. And we're finding a cloth face covering, as long as they're double layered, do very well. Screening, asking people questions. We're in our flagship, we're asking parents to do that at home in the mornings, and we're asking for temperature checks when you get into the school campus property. And then the next thing that we're talking about is hygiene, surface and hand hygiene. Cleaning, you already do. This is a little bit more cleaning on top of those soft, hard surfaces where those respiratory droplets might land, and then you take your hands, you touch it, and then you've got it on your hands and you infect yourself. So that's why the surface hygiene is important, and cleaning those hands. And I know that's a challenge It's a challenge with adults, so I know it's a challenge with students as well. And then the last part is the contact tracing, and this is so critical. This is finding someone that is ill and isolating them so they don't give it to anyone else, and then finding those people immediately around them and quarantining them so if they've been exposed, they don't spread it to anyone else. Ideally, you could eventually do that to get rid of an illness, and you've seen this in measles, or you've seen it in chickenpox or whooping cough in your schools. This is just at a much, much higher rate. So there's a lot of things I can say about all four of these topics, but I want to make sure we have time for questions. I do want to say, and in the next slide, we talk about the balancing public health concerns. The tools that we're asking you to do disrupt your lives, but until we have the vaccine, the treatment, or the cure, we're going to have our lives disrupted. Trying to get people to understand these basic principles will help us as we go into the school system. Public health is very focused on the mental and social well-being of our children. We worry about abuse at home. We worry about depression from being isolated. We worry about suicidal ideations. But we also have to balance that against the public health concerns of children being exposed, taking that home to grandparents. Since Kentucky has the highest rate of grandparents raising children, we worry about faculty and staff, even if they are not in the high-risk category of being over 65 with comorbidities. They may be living with someone who has those types of risks, and what will the faculty and staff be taking home? I appreciate the comments that the commissioner made about the fluidity of our county lines. Just because your county rate is low does not mean that something can't be brought into your community through community spread, and this virus spreads exponentially. It's 10 cases, and then before you know it, it's 100 cases. So we're very, very concerned with the amount of community spread, that even if your case count is low, this could go up rapidly. I believe that's my time for now, but I plan on being on the whole 2 hours here, so I can be available for questions as we go through the rest of the afternoon. And thank you so much for being here.
Dr. White, thank you so much. I've also been informed that I think, as I referenced, there are several board meetings going on around the state. Many of you have board meetings on Thursday night, and I think several of them are watching the webcast now as part of their meeting. I want to thank you all for joining us. Next, we have an update from Toni Cons-Tapman. She's our Interim Director of Communications at KDE. She's going to give us a communications update, a little tutorial on where to find information on the KDE website that may be useful to you. I know you also have resources available from KSBA, but we want to make sure you have the understanding of resources available on our website as well.
Okay. All right, thank you very much, Kevin. I appreciate it. I'm going to try to share my screen. Give me a moment. Of course, it was just sharing, and of course now it's not going to, sorry.
There you go.
Okay, sorry about that. I had to re-hit the thing. Sometimes we have a little glitches here at the Sauer building. So first and foremost, I just wanted to let everyone know that all of our resources are available on the KDE website. News releases, we have COVID-19 news, important documents like our guidance documents that Dr. Foster is about to point you in the direction to, as well as just different guidance that we issue our districts, obviously 24/7, 365 days a year. And then I also wanted to let you know about our FAQ document that we have been updating since March. It has 784 questions. It is a live document. I'll show you. That's kind of what it looks like when you click on it, and when you have access to the PowerPoint, which you should have received. If not, I can get that to you. But it is on our website, and you are able to search the Google document and pretty much find the answer to any webcast or advisory council meeting that we have hosted at the department. We go through and we list them in this Google sheet that anybody is able to go in at any point and try to find the answers to questions. So you can also sign up for our news releases by going to the communications page, and you can select which news releases and meeting notices you would like to receive. And that way you can always be up in touch with what we are doing here at the department. And next, I'm going to hand it off to Dr. Kelly Foster, who is going to give you an overview of our COVID-19 guidance documents and how you can locate them on our website.
Thanks, Tony. Thank you to everyone that is joining the webcast tonight. We really appreciate you taking time out of your evening to join us to hear this information. Next slide, please. So you've heard many people reference throughout the evening our Healthy at Schools document, and I want to talk to you a little bit about that document because regardless of when your district goes back to school, we released this document in late June, and this is a document that the Kentucky Department of Education, Public Health, the Governor's Office all worked on together to make sure that school districts and individual school buildings had the most recent information about what is the safest way to open your building. And so we call that our flagship document. Next slide, please. The document is posted on our website, and in a few minutes, I'm going to show you exactly where you can find that. But the document is available in 5 different languages. And if you go to the KDE website, and on the very first page, the home page at the top, you will see a blue link that says KDE's COVID-19 webpage. And when you go to that webpage, you will see educate, feed, support, and reopen. So when COVID came in March, we immediately took our focus to educating, feeding, and supporting our local school districts and our students. And so those 3 categories is where we placed all the resources that we've been sharing out in Superintendent Webcast since March. And then in May, when we changed the conversation to reopening schools, we added the green reopening tab that you see. And there are 2 different sections to that reopening tab. The first one is the KDE reopening guidance, and the second tab is the KDE non-KDE resources. That flagship document can be found in the KDE reopening guidance tab. And to date, we have released 20 guidance documents. They go out every Monday. And then on Tuesdays during the webcast, we go over those with superintendents and take questions. So if you haven't taken the opportunity to look at the guidance documents, this is where you can find them. They're easily accessible. And I think many of our districts have been using those as they develop their plans for reopening, however that's going to look like depending on different timelines. Also, under the non-KDE resource tab, you will find information from the Kentucky High School Athletic Association, from the CDC, from the Kentucky Music Association, anything that we find, SREB, anything that we find that is out there that might help a district make a decision, we've been putting those under the non-KDE resources tab. So I'm not going to go through every single one of the 20 documents, but I do want you to be aware that, the topics are very wide. I'll go over a few of the titles. So the first one was the initial guidance for district and schools. And what we asked school districts to start doing on May the 15th is to develop a reopening team and to work with their local health department, to have representatives from their local boards, their teacher unions, the health department, their emergency management teams, teachers, administrators, because we recognize that we have to have all stakeholders involved as we start to think about reopening. Also in that guidance on May 15th, we talked about having numerous plans for reopening. We asked districts to have a plan to open early. If some districts were interested in opening, say, late July, we asked districts to have a plan to open on time, which we call the traditional opening. And we also asked districts to have a plan for late opening. So districts should have, since May, been working on those 3 different scenarios, depending on what the number of COVID cases were going to look like across the state. We have provided guidance around teaching and learning, around intermittent school closure. Once you open, you have to shut down quickly. We provided guidance around food service, transportation, mental health, behavioral health. Oh, we just lost the slides. I can probably keep going without those. Tony, are we putting the slides back up? Can you all still see and hear me?
I can hear you, yes.
Okay, great. I'll just keep going. So back to the guidance. We have released guidance around facilities, what you need to do to keep your facilities safe and clean. We've released guidance around career and technical education, how to meet the needs of your learners who we know have probably fallen behind during COVID-19. We have released guidance around special education and guidance around non-traditional instruction moving forward with participation rates, how to feed your kids over the summer, as well as the most recent guidance around library media centers and class sizes for virtual instruction. So, as Kevin has already mentioned to you all, if for some reason you decide not to follow the recommendation, I highly encourage all board members, site based decision making councils, principals, teachers, everyone involved in this to please look at that Healthy at Schools document, our flagship document, because the expectations at the beginning about temperature checks, wearing face masks, social distancing, making sure that you're cleaning your buildings and that your supplies, all of those things really take a whole nother level if you're going to open before the time that is being recommended by the governor and public health. So I really encourage you to look at those expectations in the flagship document. And also, as Kevin mentioned, the second part of that document are the best practices. And we know that not everyone will be able to implement those best practices. But if you plan to open now, you really need to consider about how you have a plan to use those best practices on a daily basis. Thank you.
Thank you, Kelly. Dr. Foster, and we have had a little technical difficulties here. Our slide presentation is the computer went down, but it will come up momentarily. Next, we have an update on career and technical education with Associate Commissioner David Horstman. David, will give Tony just a second to get the slides.
Is it back up? I have a little power
Yes,
surge
yep,
in my office.
Yes.
Yeah,
Sorry.
you're good. You're good.
David is our Associate Commissioner in the Office of Career and Technical Education. There's some pertinent news related to how we will be delivering career and technical education services during this period, and then of course on through the semester. We want to make sure we know those are important programs in your communities, whether you have an ATC, whether you have a locally operated center, whether you're sending students to an ATC, or all of the above. And so we want to make sure we're getting you this information. David?
Looks like he was on. Is he muted?
David, are you on? I know you're on. I can see that you're on. You don't think you're muted.
Hopefully he didn't have that power surge.
Why don't we pause for, look, I can see David trying to come back on. Tony, let's just pause this presentation. Let's jump over into some questions.
Okay. All right. Let me stop sharing there. Oh, nope. Well, there he is.
There he is. David Horstman.
Can you hear us, David? I think you're muted, though.
All right, am I back on now?
You're back.
Good.
We're
There you
back. All right.
Hello?
Yep.
All right, I'm gonna go ahead
Okay.
and share you again.
I'm sorry. I've had trouble with Teams this afternoon. We just have a couple of things that we want to discuss with you tonight. We issued some guidance on June the 29th of this year that allowed our secondary students to reopen in our career and technical education centers for completion of industry certification and the lab-based dual credit coursework. And that was approved by the Department of Public Health and the governor's office. And we're going to have to call a halt to that as of August the 24th. And we will also, all 51 of our state-operated area technology centers will abide by the governor's recommendation for non-traditional instruction through September 28th, 2020. So we will all be going with virtual delivery during that time. And then following that, depending on how different districts open, we will have guidance for each of the districts as to how we'll serve all the students wherever they may be, whether it's virtual or online or in person. Thank you.
All right. All right, I think that is what we have there.
Tony, while you're pulling up the questions, I also want to welcome Dr. Emily Messerly. She's also with the Department for Public Health, works alongside Dr. White. They have, both Dr. Messerly and Dr. White, they were assigned to education as from the public health team. I'm not sure, you don't tell us how you feel about that. I think we're more complicated in education than you thought, but it's been a great relationship, continues to be with that partnership. Dr. Messerly, welcome. Thank you for being on tonight.
Our first question is going to probably go right to the Department for Public Health. And they're wanting to know if our the COVID-19 positivity rates tracked by region and or county. You're on mute.
Sorry. The answer to that question is neither. The positivity rate is the total number of positive cases, that's the numerator. Your denominator is the total number of cases that were tested, the total number of COVID tests that were done. In the state of Kentucky, there is a law that requires that if a test is positive, that the laboratory as well as the provider must report that disease entity. If it's one that's required reporting, which COVID-19 is, must report that to either the local health department or the state department for public health. So we have managed to get a good stream of data to us of the positive COVID-19 tests. The problem is there is no test, there's no law that requires them to report us the negative tests. And now remember, that's your denominator. You have to know the total number of tests, negative and positive, to get your positivity rate. So we have struggled over time to get laboratories to let us know the number of tests that they have done, negative or positive. In March, we were able to develop a survey monkey where we actually, and we are physically calling, if they're not sending in, every laboratory in the state of Kentucky has to tell us how many positives they had and how many tests they did. So all we have at the end of the day is the total number of tests done across the state of Kentucky. So we don't have by every laboratory how many were done in Taylor County or Franklin County or Fayette County. We know the total done statewide. Now, that being said, you are seeing some positivity rates by county. They are pulling that data from the electronic system that there is in the state of Kentucky, where some of our laboratories don't just give us test results. They actually feed their electronic system into a state electronic system. So we do have some counties where we have some of the total number of tests. But the problem is I might go to Fayette County and get a test done even though I live in Franklin County. So those positivity rates are not clear and solid like we would like them to be. Once we get all the laboratories that are testing Kentuckians into our electronic data system, we will have much better regional and county information. But right now, we are getting a good number of the total state testing, but we do not have good numbers for county and certainly not for regional numbers. So that's way more wonky of an answer than you probably wanted to have, because the solid answer is right now we do not have the ability to give you a reliable number for your county. Leslie wanted to add to that. What did I leave out?
Yes, the comment that I wanted to make to maybe explain this in a different way, and I can use this a little bit coming from the primary care world where I practice, is that collecting all the negative tests for public health is not actually a normal practice for us. We usually collect the positives, and then we collect it based on how many people tested positive per 100,000, and that's called the incidence, and that's usually what you see on the maps. But this positivity rate, how many negatives and how many positives, this is really digging deeper into the data and statistics that typically as public health we don't do. So just like everything else with this pandemic, it's all new processes. And so right now we are providing and giving you the best data that we can based on what we do for other infectious diseases. And we're trying to change that and pinpoint it more, if that makes sense.
Right now, we are actually taking some of those test results that I mentioned. They are being faxed. I know it's 2020, but we have 5 employees that just stand at our fax machines, and we get up to 800 fax a day. We have to take those faxes, then we have to enter them into our electronic data system to be sure that we can report all of this out to the CDC as accurately as we can. Sorry, I got wonky again.
All right, that's okay. All right, our next question. Under the current mask mandate, a student must wear a mask everywhere indoors, even if he's 6 feet apart from others, unless he's actively eating or drinking. Why are students permitted to remove their masks for the duration of each class simply because they have 6 feet of space from other students? So many hours of indoor exposure to many others without a mask seems unnecessarily risky.
The way that we intended for the flagship document to read was, if you are in a classroom, everyone's 6 feet apart, no one's moving, the teacher's separated from everyone, there's not any moving going around in the classroom, that we were going to allow the students to have a mask break. But it was not an intention for someone to sit around all day with their mask down. We are learning more since we've written this document about the importance of ventilation. And I know that's been a big topic for the Department of Education and for the Department for Public Health, of hoping we can find ways for there to be better ventilation in every room. But the point was not that we would sit around all day without masks on. As many of you do, if you're apart from a friend and you're sitting 6-8 feet apart, you may not wear a mask while you're talking. But if you're moving around and getting close to that person, you do want to be masked because of those respiratory droplets I mentioned earlier.
Okay. The next question is going to do with just they want to pursue with the current school year. Talking about pediatricians have stated that it's in the best interest for the well-being of the youth, and they're just wanting to know what exactly is delaying the in-person school for another 5 to 6 weeks, because the schools have been well prepared to open and they feel very comfortable with their reopening plans. They do want to note that they are very aware of the severity of COVID, particularly mentioning that their husband and daughter both work in the medical field and take precautions daily, and they would never want to put anyone in harm's way.
I'll start out, and then Dr. White, if you can follow up. You know, as the governor said today, we went over the reasoning behind the recommendation. The plans, it is believed by our public health experts, based upon what the virus is doing today and has been doing for the last few weeks, the plans, even though your plans are good, are not likely to be successful in this environment when the virus is increasing. And as the governor said today, the disease burden in Kentucky is at an all-time high as of today. And in that environment, it is not recommended that we implement our plans, no matter how good the plans are. The plans are designed to where we hope the state will be on or around September 28th, where the virus is still present, but we're not in an escalating period of community spread. Dr. White?
Yes, and I think what prompted this is if you look at our case rates in July, after the 4th of July holiday, we saw our rates going up, and the fear was the exponential rate potentially going up. We saw a couple of weeks where that started happening. Then we were visited by Dr. Burks, who said the reason I'm here is because your numbers and your trends are looking like the states south of you, and she was very concerned that all those states that you see on the map that are red looking, that's rising up toward Tennessee, Kentucky, Indiana, Ohio. That was her main reason for coming here, to alert us, and we were aware of that trend, but she just wanted to be sure that the federal government was letting us know at the state level that we were following a pattern, and if something wasn't done, we were going to be the next South Carolina or the next Mississippi, and see those rates not just increase, but exponentially go up. When we added the mask mandate, we saw those rates begin to start to flatten, but I think that fear of where were we going in that trajectory was what prompted the governor to say it seems ill-advised to open schools when you aren't sure what your trajectory is going to be, but you're looking at your last few weeks of data and it has been going up. And that was the frightening piece of that. And that's weighing what one mental health or one public health risk versus a different.
And Commissioner Brown, if you don't mind, I'll interject here. This is Jacqueline Coleman. For all of you who are on here, I have said more times than I can count that if there is a group of people that I trust to create and implement a plan with fidelity, it is the education community. And I've said that over and over again because I'm part of it. I worked with these colleagues my entire career, and I trust them implicitly. They're responsible. They care for our kids every day like they're their own. And if there's any group I trust, it's them. The issue truly right at this moment is the time and situation of the virus. It has nothing to do with the capability or incapability of school systems. It is where we are as a society with this virus escalating at this point.
All right, the next question is, and I can't tell, I know a couple of parents submitted some questions as well, which I also allowed via the Google form because it is a virtual town hall and some of our board members are parents. So this one does come in from a parent. Our district is not starting until October 28th. To allow for fall break and a 2-week quarantine period for vacations. Their official announcement includes this exact wording. Why are fall break vacations acceptable and being worked into the schedule when our kids have been out of the classroom for 7 months?
And I'm not sure what district is, and it doesn't matter what district this is, other than, calendar questions about when we're having fall break and those types of things. Those are the ultimate local decisions. I'm sure the board discussed that calendar. There are also calendar committees, and we also know that we've encouraged districts, and many of them have done this, to have a reopening committee, a education continuation committee or task force to advise the district on how to get back in and providing education instruction in addition to what the school year looks like. So I'm sure that district had community feedback. Many districts had surveys to parents in the community, and don't know the district, but my guess is that superintendent, based on feedback from the community, talking with staff, local board members, that's how they arrived at that decision. And every district has different reasons for how they want to have breaks, divide the semester, and those types of things. Can vary greatly, even a district that's next door to each other.
All right, the next question I'm going to read from the screen because it's a long question, but I'm going to summarize as best as I can. It comes from another parent. Basically, I think this is going to probably come down to device question, just talking about wanting to know a lot of parents working outside the home. It's not feasible for them to have their child logged in during the day. They have one computer, 2 kids. How does the school, how the school is proposed that they teach 2 kids at 2 different times, 2 different grades. So they're having a lot of issues within their own district with the virtual learning. And why can't the school board or school districts allow students to do what they want to do in person and let the other ones do virtually? Whatever works best for their situation.
David Couch, do you want to address? I think this question was touching on accessibility and digital learning. Do you want to, or David Cook as well, talk to that?
Well, I think both of us, we recognize that there's an effort by school districts to address the end device, the computer. And I know that a lot of them are going very aggressively trying to address the devices going to the home. A lot of them already had one-to-one, particularly at the middle school and high school level. And with the CARES fund, that was the federal relief funds that have come in, we see close to 90% of the school districts are trying to address the remaining amount of students that didn't have one go home. For example, the younger grades, maybe K through 3, the students use them in the libraries and the labs. Those were desktop computers that don't easily go to the home. However, a good number of them already had mobile computers, but they're in the process now of going full court press for identifying like Chromebooks and other really mobile devices to address all grade levels, K through 3. I know in LaRue County, they already had K through 12 computers, but only really at the middle school and high school, they allowed them to go home. And now they're reassigning them and letting them go home to younger grades. And we're seeing that across the board. At Covington Independent, they had computers for middle school and high schoolers, and they've addressed the orders for the younger grades. So we are seeing that addressed. We recognize that it is difficult for 2 child. I mean, I'm a dad of 4, so I'm very familiar with the difficulty of sharing one device, let alone anything at the house, but a computer especially. But that we do recognize that. I do see districts have that as a very high priority to address. David, would you like to add something to that?
Yes, David, thank you. Commissioner, I just wanted to add, I think inherent or part of that question is also making sure that districts are really being focused on the balance between asynchronous and synchronous learning. And what I mean by that is kids need to be able to do their work when they can do their work and when families can do their work. And sometimes we know that there have been situations in the spring where sometimes it was sort of it's all synchronous. So you have to do the work at a particular time in the day. And we hope that as people have learned over this time, that for remote learning to work as effectively as it can, it needs to be a combination of some things that are just in time and some things that kids can do when mom and dad get home from work, or when there is a need to share a computer, that they don't have to do things at a particular time in the day. That's what I was going to say.
Okay. All right. So that was kind of the answer for the virtual one. We do have a couple of questions from board members that were asking why we're holding this forum now, with this virtual forum now, after the many phone calls from their teachers and their constituents and other school staff and everything that they've done to start the school, to try to reopen this and start this school year. So it seems like there's a little frustration and they want to know why we're doing this town hall now. So I will leave that one out on the floor.
I'll answer that one. The primary reason we're doing the town hall now is because we are hearing that there's great level of controversy and discussion in your communities about the governor's recommendation to not have in-person classes until September 28th. Up until now, the governor has always made recommendations and never mandated has been consistent in that in all the decisions and recommendations made related to COVID-19. And while you all have had discussions at local district level, we've had 171 districts close within 48 hours in March, and again, shift over to NTI later in the spring. And it's a testament to the leaders we have at the local level and how we operate the education system in Kentucky. I'm not saying that because I'm here. I'm saying that because that's been a tradition for 30 years. There are numerous opportunities for members of the education community, including board members, to get information since March related to the crisis we're in. There's superintendent webcast every week. Of course, that is the primary audience is superintendents, but that is a link, Tony, correct me if I'm wrong, that is public and can be utilized by board members and others. You also have communication services, of course, from Kentucky School Boards Association is very good, and they monitor and are on various, as I mentioned earlier, to begin the webcast. They serve in your representative capacity for the members and sit on the Education Continuation Task Force and monitor what's going on, as well as day-to-day conversations with us at the department. So multiple reasons, but the primary reason for this town hall was due to the feedback we were getting from local boards and superintendents about this upcoming decision based on the governor's recommendation.
And that's correct. All of our webcasts, and we have been hosting the special superintendent webcasts. So those used to be monthly webcasts that were just hosted with our superintendents. That typically were getting anywhere from 100 views or 100 live viewers a month to as soon as COVID, in March, we started doing them weekly, and we have done weekly superintendent webcasts every Tuesday from 2 to 4 since mid-March. Dr. White and Dr. Meserly were our first guests. And here we are in mid-August, and we're continuing to do those. And we do host, they are open to the public. They are called special superintendent webcasts. They are open to the public, and that there's a reason for that, because, we want everyone to hear the questions, and so that in case there are any questions that need to be left that we need to answer, we will answer them later. And then we also record those, and they are shared later on via links, or if you can't listen to them during those times as well. So again, I know a lot of people work during the day, but you can always find links to all of those webcasts and information that we receive or that we release from the department through the department's website.
And so, Tony, something I left out, we also have the local board member advisory council that advises the commissioner. The commissioner has numerous advisories for various role groups. That council did meet virtually when we were in the height of developing the 18 to 20 guidance documents that was referenced by Dr. Foster earlier.
All right, the next question just talks about, it's a pretty lengthy question, and I'm not going to go into all of it, but it goes into they've examined the statistics from the CDC as well as the Kentucky COVID website, talking about how while the case numbers have increased, the death rate has remained flat. And in addition to this, the increase in cases directly correlates with the increase in testing. And they just want to know, given all of this information, the rationale behind the increased risk to children, along with the disservice that they feel that we're doing to kids by giving them less of an education than they feel like they deserve in light of these statistics. They feel the risks of remaining closed to the long-term health of our kids outweigh the risks of reopening.
I want Dr. White to comment on the bulk of that, but I do want to reiterate, and I agree with what the governor talked about. We are, while September 28th, we understand that that's getting into the school year significantly. I understand it's not lost, but we are asking for districts to consider a delay of in-person for that period of time so that we then can reopen in a period where the virus is not as rampant across the state, and so that we can stay open. We know that on September 28th, districts and boards can come back together to amend calendars. As popular or unpopular as it may be, could eat into fall breaks and take those away, could talk about going into some of the winter break to get in some more in person to try to make up for that time. And we really believe it is worth that. We understand, don't get me wrong, we completely understand and agree. Nobody, as I said earlier, we're not disputing the fact that non-traditional instruction is not as good as in person due to all of the other, no matter how, and we have great teachers and they're doing a great job with non-traditional instruction. And I think Kentucky does, in many cases, a better job than most states around the country with non-traditional instruction because we have a history of it and we also have the technology support. But we also have never called it digital instruction because we've always known that there will be children that don't have access, and so districts have 10 years of experience. About 80 of our districts at least have 10 years of experience of delivering non-traditional instruction through non-digital means. Dr. White?
Just making sure I wasn't muted. Yes, I think the points made by the person who wrote the question were very good. They're talking the point about you're 3 times more likely to die in a car wreck, 6 times more likely to die of a drug overdose, and they listed a whole bunch of events that could kill someone in the state of Kentucky, and that's I believe that those numbers are accurate, that they've taken off of the CDC website. I think what we have to understand is death is not our only metric, although that's a critical one, especially for those people that have been touched by this in that way. I think we don't know long-term effects of people who have been ill from this disease, of the multi-organ failure that they have, even those people who have been able to recover from this, which is exciting. I think we're seeing our death rate is lowering or is not going up. It's flat, I believe is the term they use, because we're seeing more young people that are having this disease. And the more young people that have it, you're not as likely to see a death rate from them. However, we are seeing a continued flat death rate from this because older people and people with comorbidities are being exposed. And unfortunately, we are seeing more and more younger people younger when you're my age, 50 is younger. So I think that the one metric of death is not the only metric you want to use. I think it's traumatic for kids to see family illness. I think Dr. Redfield, who's the director of the CDC, read an article about him from yesterday where he said, this is not public health versus education. This is public health versus public health. We have to weigh all of those issues that the person writing the question has. What kind of effect is this going to have on the children versus what kind of effect is it going to have if not only do we have outbreaks, but could bringing all these people together at a time when we are having higher numbers, could we make those numbers go even higher as we have much more interaction in a school setting of faculty, staff, and students. So I think it's much more than let's look at our death rate, which is critical. I'm pleased that it hasn't gone up. I'm pleased that it's flat. I would be much more pleased if it was down. But I think the points are well made. We have to make a judgment call. And I think the judgment call the Department of Education, the Department of Public Health, and the school board is making at this point is this judgment call at this point in time with the virus where we are now is not to have face-to-face. That's a decision that the people on this call will be facing.
Okay. All right, the next question, I'm not sure if we know this, but I'll go ahead and ask it. And if not, we will mark it. This is what we do in our webcast. If we don't have the answer to the question, because believe it or not, we don't have the answers to everything, we will mark it and we will make sure that we get it back to you. Do we know what is the case percentage number that the governor considers an acceptable level for schools to reopen? The case percentage number.
I think that gets back to having a metric. That it would be great if there was one metric that we could use that said, okay, everybody, when we get here, it's safe, but when we're here, it's not. And the problem is it's a combination of a lot of things. I've said earlier, we heard a school superintendent say, I used to think trying to figure out what was the best, what to do on a snow day was a hard decision. This is way harder than that, because you're looking not only at your death rate in your community, your case rate in your community, you're looking at how much does your community mitigate against this. Do you have a community that is wearing masks, that are socially distancing, or do you have a community who are having events, who are not following recommendations, and are they going to help you increase this rate in your school to increase community spread? It's not just the people in that building that we're worried about as public health. We're worried about them, and then we're worried about where they go when they go. So I wish there was a number that we could give you that we could solidly say this is safe and this isn't. It is a complex decision that every superintendent, every principal, every school board is going to have to make. So I've not talked to the governor about this, and I think we can put it on the list, but I don't think there's going to be a number where we're going to say this is safe and this is not.
All right.
So, and let me jump in. I'll just add this. The governor said this. I repeat, the governor did not say this. I read this in an article today covering this as a national issue. But to give you an idea of what some people are saying is a safer rate to return to school. One article I read, we are almost double that right now. So again, there's not one metric. There's too many variables. The governor or Connie White did not say that. But just to give you an idea of where some people's heads are, that's the number that I read today.
Great. Thank you, Lieutenant Governor. The next question that has come in is, what will be done if a classroom has more than 41 students in the room? And I think that 41 number is going, I think they're getting that from isn't that the virtual recommendation? But I think that might be confused with, they're asking about 41 children in a physical classroom.
Well, I'll start off, and then I'll go to Kelly next. First of all, when you look at the Healthy at School guidance, the first thing we ask districts to do, and we know you've already had this exercise in your districts, but we ask you obviously to survey your buildings, the footprint of your buildings, the capacities of your buildings. We want districts in developing their plan for when they go back to in-person classes, that they maximize space, that they utilize spaces so long as it's safe to do so. From the gymnasium obviously is a safe space, but you may need to have a class in gymnasium to space people out. You may need to use the cafeteria as a classroom in certain times of the day to space classes out. Now, ideally, if you had a building that much under capacity, you would be able to have the 6 feet social distancing in every classroom, and we know that is not going to be able to occur unless you are doing a hybrid schedule and rotating students in and out on that type of schedule. Dr. Foster, do you want to follow
Sure.
up with that?
I would just say that I think maybe some guidance is getting crossed over there. There wouldn't be a normal classroom setting that would be able to have 41 kids in there with the social distancing 6 feet apart requirements. As Kevin mentioned, possibly a cafeteria or a gymnasium could be used for 41 students being 6 feet apart. We recently issued some guidance around virtual class size. And that guidance basically has 2 parts. The first part comes from me, and it is, if you are a site based decision making school, you more than likely have policies around class size. So you do not have to request a waiver or an exemption from KDE around virtual class size. You just need to amend your local policy for class size, and that will cover you if you are going to have more than 32 high school kids in a virtual classroom setting. So if you have a site-based, you need to look at your local site-based decision-making council policies. Also, you need to double check your board policies and make sure that your local board does not have any type of policy that would need to be amended around class sizes. If you are one of the few A1 schools across the state that are typically K-12 buildings that do not have a site-based council, or you are an A5 program across the state and you do not have a site-based council, then you need to email me directly, kelly.foster@education.ky.gov, and I will send you an exemption form for you to be able to adjust your virtual class size. If David Couch or Marty Park is on and wants to talk about the second part of that guidance that dealt with best practices for virtual guidelines, are either one of you all available?
Well, I am, and I know, Kelly, that's part of the documents that you're handing out, and that would be quite some time to go over all the best recommendations that are in there. But we spent a lot of time with districts, and every district has an educational technology point of contact, working with them along with other members of the district office, making sure they're aware of those best practice guidelines.
All right, the next question, and I think this goes, this has been asked a couple of times. So again, if I don't get to your specific questions, I'm getting them and putting them all together. Masks and social distancing are proven to greatly reduce the spread of COVID. Why were districts not allowed to make local decisions to follow these guidelines for a safe reopening? What level of consideration was given to the significant negative impact, in parentheses, depression, abuse, etc., to kids when schools are closed to in-person instruction?
First of all, the districts do have the ability to not follow the governor's recommendation, as I indicated earlier in the explanation of that issue. So you do have the authority to not abide by the governor's recommendation. If you do go back, as I indicated, at least one district that I know of going back on Monday, they have to abide by their Healthy at School plan that they put in place. But I'm asking them to double down on that plan. It has to be 100%, and I'm asking them to go back and look at best practices. And we want districts to abide by and follow the governor's recommendation. Those of you, vast majority of school districts already know we're going to do that and go back on September 28th. Your plans, that's exactly when you will utilize your plans. None of that was done in vain. The virus will still be around on September 28th. The idea is that we get through this 5 to 6 week period, and then we're in a better place to start school so that the plans that you've put in place can be successful. That the virus, and we've had time as a state using multiple mitigation measures to get the numbers down. There's the other part to that question, Tony, remind me that I didn't answer.
Sorry, let me go back. Sorry. What level of consideration was given to the negative impact, things like depression, abuse, etc., to kids when schools are closed to in-person instruction? And then we addressed some of those things in the guidance documents with the social emotional.
I don't have a metric on that other than it has been first and foremost a consideration. The governor has addressed that, has talked about how important that was, how that concerns him for his own children, but obviously for the Commonwealth's children. He's using his children as an example of understanding the value that they get out of in-person classes. We also know all the other social and medical supports that students get. We know there is no dispute about that. But what we are facing, and as Dr. White and others have said, this is not a public health versus an education issue. It's a public health versus a public health issue, that we have to come together as a Commonwealth to try to get this under control so that when we get back in school, we can stay in school to ensure that we have consistency in those resources. I can tell you that we are working with public health today And you heard the governor mention this of the district, the vast majority of districts that are going to be following the governor's recommendation will be able to have flexibility under new guidance that we're going to be issued working with public health to be able to bring small groups of students in for counseling, for other social emotional supports, for orientation, other speech and mobility type issues so that that can be addressed. And it's one way we're trying to facilitate that as we move into this semester.
All right, our next there's another, I think we lost Dr. White, but she said she was able to get back on via phone. So just FYI. I do think this next question is going to be for KDE staff, though. This is going to probably be for pertaining to special education. It is impossible for districts to meet regulatory requirements to provide many students individualized education plans through virtual classrooms alone. Not to mention the liability position under the recommendation by the governor that places our districts in by preventing us to meet the regulatory student accommodation requirements per place written in the 504 plans. They're wanting to know that will Frankfurt assume all these legal liability consequences, etc., and how they need to proceed with all of these things. Carol Ann, are you on? Oh, yes, you are.
I'm on.
There you are. Sorry.
I'll go ahead and I'll address the individual education program question. And then if Todd wants to add anything about liability, he can feel free to jump in. The requirements of the Individuals with Disabilities Education Act have not changed during the pandemic. Therefore, students with IEPs are still entitled to a free, appropriate public education. And so school districts should work through their admissions and release committees to make decisions regarding individualized needs for students. If there are concerns from the district or from the parent about how FAPE will be provided in the virtual environment, they can come together through that ARC process and make decisions as needed for how to best provide a free, appropriate public education for the students during this time.
And I'll follow up on Carol Ann's comments. She's absolutely correct in what she has provided there. I think that the provision of FAPE for our students with disabilities has been a concern for all of our school districts, all of our educators, even when we were doing NTI or remote instruction at the end of the last school year. What is important to keep in mind, however, is that NTI or remote instruction in and of itself is not a violation of FAPE for most students. Most of our students with disabilities can have their IEPs implemented, we have found, through NTI or remote instruction. For those services that simply aren't able to be provided to a student with disabilities as required by their IEP during NTI or remote instruction, then the school district should document those and make those services up to the student at a later time.
Okay, and we have another kind of follow-up question with IEPs from a different person. They just wanted to know what assistance, if there is additional assistance, and I know that we do. And again, I'm not sure if they're aware of the webcasts and the different things that we provide. Maybe we can let them know of the different services and things that we're providing assistance from our particular office. They said that they wanted to provide some in-person time, which they believe that KD had resisted. I also think maybe we could talk a little bit about the small group flexibility.
Yeah, Tony, I'll jump in there really quick. We have, in addition to the KDE COVID-19 webpage, we've also designed one for the Office of Special Education and Early Learning. And so you can access that link from the KDE COVID-19 page, or you can just type it in the search bar when you go to the KDE site. And there are a lot of resources on there from both the state level as well as the national level regarding IEP implementation and FAPE during the pandemic. And then also, I see Kelly jumping on. We've been working in conjunction with her with the small group guidance.
Sure, and I'll speak to that if you don't care, because
Yes,
none of that is
go
actually
ahead.
approved. So
Go ahead.
Yeah, no. So we are working with public health and the governor's office on some possible guidance that we talked about Tuesday during our superintendent's webcast, and that we hope to release on Monday and be able to talk about in great detail on Tuesday during the webcast. But Kevin mentioned it briefly. We are looking at, are there ways that we can bring small groups of students back into the schools, groups of 10 or less, possibly for evaluation needs, possibly for hands-on experience like career and technical education, mental health or academic counseling, occupational, physical, and or speech therapy, or targeted remediation or tutoring. And so that's really all I feel comfortable talking about right now. But I will say that I do think that we are headed in the right direction with this, and hopefully it will come out Monday. And if we're able to get it out sooner, we will. But once we have that finalized and approved by everyone, then we will definitely be sharing that with our local school systems.
And I just want to add again, just to invite everyone, in case you're just joining us, and I know it's 7 o'clock, we do release those guidance documents on Monday. We do release them to your superintendents. And then we also send them out via media release and via social media. And then we always talk about them during the webcasts on Tuesday from 2 to 4 p.m. Eastern. We've hosted the webcast every Tuesday from 2 to 4. Since mid-March, and even though it's called the local superintendent webcast, it is open for anybody to listen, and we archive those, and they are recorded. So please feel free to join us for those. And as Dr. Foster said, we will be discussing hopefully discussing the small group flexibility during that webcast on Tuesday. The next question is, just concern about how schools are going to be able to maintain social distancing with class sizes being so large. They're even talking about the 24 to 27 and the desks being 6 feet apart. And then also elementary students and middle school students to wear masks all day.
So I'll start that, and then if Robin Kinney or Kay Kennedy want to jump in on any of that. So I think when thinking about the social distancing in the classrooms, most school districts, when they do go back to face-to-face instruction, are probably going to offer some type of hybrid model where you have some students doing virtual learning at home, some students coming for face-to-face instruction. So when you have fewer students there in the school building, you may be able to do things like have a desk further apart in a classroom instead of having 32 high school students in a classroom. If you have half your student population doing virtual learning, you may have 15 to 16 students in that classroom. You may be able to use spaces like gymnasiums or cafeterias to make the actual class size or actual number of students in a room smaller. So in our guidance that we've been releasing, I believe it's the facilities piece. It talks about, there's actually a calculator where you can figure out how many students you can get in a classroom based on how large that classroom is. What are the actual dimensions and how many desks that you can get in there. The masking piece, in our guidance around mask with public health, I think our slogan is, if you move, you mask. So there are situations where if you're sitting in your classroom and you are 6 feet away from all students, that a student would be able to take a little bit of a break and pull their mask down. But if a student was moving around in the classroom or walking down the hallway or going to the cafeteria or to the bus, anytime that there is movement, the student would be required to have their mask on. So there is some flexibility in that. I'll turn it over to Robin to see if there's anything she wants to add.
Kelly, you've done such a good job. I'm going to adopt you as part of our operations team and finance and operations. I really don't have anything to add. I will say that we've received a lot of questions from local school districts, really trying to think about that social distancing. We've had questions about tape measures, and is it radius, or is it, how do we actually measure it? So we have been hearing good positive feedback from our districts that they're really trying to implement the social distancing with fidelity.
having a little glitch on the Google form, so just give me 1 second to refresh my screen. I think also, and for those of us that are, I know some people are just joining us now. There's the question again, Dr. White, if you can talk about why we can't do the regional percentages that is coming in just even since this webcast has begun. So I'm not certain that maybe they heard, I know that was the first question that was asked. So while I refresh this towards the beginning, if you could possibly readdress that question.
Sure, I'd be happy to, Tony. The idea of trying to look at individual counties or regions for positivity rate, and I believe that was the question that was asked earlier, is our positivity rate that we have with the data that's given to us by the laboratories is given to us as a statewide rate. The reason for that is we know who the positives are. We can tell you that. That's the numerator. But the denominator is the total number of tests that have been done. And we have, at the Department for Public Health, unless that laboratory electronically submits all of their data to us, and there are only a handful of labs that are doing that, we do not know the total number of tests that were done in your county, nor do we know the total number of tests done in your region. So without knowing what your denominator is, how many tests were done on people living in either your county or whatever arbitrary region line you wanted to draw around a group of counties, that number can't be calculated without a solid number telling us what that denominator is. And until we can get all 200 laboratories that are doing testing on Kentuckians to tell us so we can find out the total number of tests done, we can't give you that solid number by region or by county. That's the goal. That's what we hope to do. And as Dr. Meserly said earlier, no one ever asks for that rate. That's never been something that we've needed to report because we've never had a pandemic before. So there's no system in place for this reporting, and there's actually no law that requires labs to report those numbers to us. So it has been an ordeal to get this done, and it is something we're working on desperately, but we have it's not that we're keeping any information from anyone. There is no way to accurately calculate that at this time. Does that cover the question? Since I can't see it, Tony, I want to be sure I answered that.
Yes, I mean, it's basically wanting to know, going to why couldn't they use local, regional instead of state? If there's a hot area in one part of the state, why couldn't they use I'm trying to summarize some of the questions up.
Sure. Well, and getting back to the fluidity of the borders, if you live in one county, you're not the border doesn't go up and there's no traffic across that county line. You're going to have people delivering products to your school. You're going to have teachers. You're going to have staff from other counties. And even though you may say, well, that county over there is where the high incident rate is, this virus travels so quickly and spreads so quickly. It does not take a large number of people coming to your county and infecting people that are then closely together in a school system, and then they take this virus home to their families, and soon this virus is spread rapidly throughout your community. And now you are the hot spot, not the county next door or 2 counties over.
All right. The next question we have is talking about the gifted student service plans. Explain how virtual only school can possibly comply with any part of the regulatory requirements of 704 KAR 3:285 and gifted student service plans, in parentheses GSSP. I'm hoping that we have somebody on staff that I know we have people on staff online right now that could answer that. If
Sure,
not,
Tony, this is Kelly. I'll start, and then Carol Ann may want to chime back in there. I think that might be a situation where when we finally release the small group guidance, that could be something that would possibly fall under the category of, hold on, I'm looking at my notes here real quick, around the targeted remediation, tutoring, instructional type things. So more to come on that. But Carol Ann, is there anything you want to say regarding gifted and talented services?
Yes, thank you, Dr. Foster. I was just going to add that in our reopening guidance, considerations for exceptional learners in preschool, that's one of the guidance documents that Dr. Foster discussed earlier. There are actually some recommendations in there for gifted and talented students, and so those might be helpful for you to review as well.
Thank you.
Thank you both. The next question is, isn't the positivity rate in parentheses largely a function of the total number of tests administered? In many areas outside of central Kentucky, you cannot get a test unless you have symptoms or have been exposed. So many quote unquote healthy people are not or cannot get tested. If only people who feel sick or have been exposed are tested, the denominator is going to be artificially small, therefore making the overall positivity rate artificially small, is my understanding. Can someone, Emily or Dr. Meserly or Dr. White, are you able to provide some clarity?
I can actually read the question. Somehow I'm able to get back on, but I'm not going to try to do it with the video. You're correct that your numerator and your denominator, that's where your positivity rate comes from. There's been a great deal of effort to try to increase testing across the state, and you can go to the website and see where those sites are, at least that we are aware of, people that have reported to us where they're doing testing. Do we have testing every place we would like to have testing? I would say the governor would even agree that we don't have it every place we would like it. In the areas where testing is not as plentiful, that's where I know in some counties they're saying you only can get tested if you're symptomatic. And that's certainly where we were at the very beginning of this crisis, because the only place we had to get testing was at our state laboratory. Our state laboratory is not a commercial laboratory, and it is not built to do large numbers of tests. We don't have the equipment or the personnel to do that. But we did that at the very beginning because we were desperately trying to get tests for our high risk, our first responders, our healthcare providers, people in prisons and nursing homes. That finally loosened up as we began to get testing across the bigger laboratories. And we've been very lucky to be able to have laboratories in the state of Kentucky who have developed the ability and the bandwidth to do more testing in Kentucky. That's something that we continue to work on every day to get as much testing as possible. I'm going down another rabbit hole, sorry, but it's very personal to me, and we're very passionate about getting the testing that we can get out there. But yes, the positivity rate is determined by the numerator and the denominator, and that's where that positivity rate comes from. So if you have a laboratory one day that suddenly calls you and says, golly gee whiz, our last 4 days we haven't sent you cases, you may get an influx of cases. That can happen. It is all dependent on the numerator and the denominator. But the positivity rate that is being reported is a rolling rate over several days. So that tries to even those fluctuations out. I hope that answers the questioner's question.
Okay, Dr. Meserly, you have your hand up. Did you want to add something?
Yes, I just wanted to add two very supportive and positive things that both the governor and Dr. Stack have done in regards to testing. There most recently, Dr. Stack removed, there's an executive order, removed the requirement for a doctor's order for a COVID test. So if anyone in rural Kentucky is getting told that they have to have a doctor's appointment and they have to have symptoms to get a test, there is a state executive order that you do not have to have an order to get a test. Also, you do not have to pay to get a test. That's another governor's order. So those are two barriers that we have removed. And then also the state is currently, with extra federal funding, we are rolling out a mobile testing, some mobile testing units to come to areas with a van to test in areas who don't have access to testing. Thank you.
Okay, the next question, just wondering is, do we know when do we think we will have labs on an electronic system to start recording these positivity rates?
Well, I can tell you that that's underway right now. First, you have to get the laboratory to agree that they even want to do that, because as I said, there's no law that requires them to do that, although they're getting a lot of pressure and they are beginning to be more cooperative with doing that. I know we have an epidemiology meeting every morning at 8:45, and that's when the person that is working on that reports. I believe there are about 4 laboratories that are very close to being on the electronic system, but this is a one-by-one slog, because these are electronic data systems, and those data fields have to match up just exactly. And we're getting into, I'm a physician, so we're getting into computer language that I can't really articulate very well, other than to know this is not as simple a process as it sounds like. And there are people working on this 7 days a week and have been working on this 7 days a week since April to try to get us the best data that we can. And that's why, and I know the questioner says it's difficult to make these decisions with statewide data. I think when you think about how easily this virus spreads, that what is happening in 2 counties over could very easily be happening with you, and you don't want to use a positivity rate as the only number that you're using. It's so much broader than that.
Okay. And then the next question is, does the governor have an idea as to when he would make a call on pushing us out again from September 28th? And to kind of piggyback off of that, another question in terms of why does DPH and the governor believe that what's the magic date, or why is September 28th a magic date when right now it appears that the virus is pretty hot on that? I'm not sure if the lieutenant governor is still on.
Well, I can speak to the September 28th date based on conversations that I had earlier this week, over the weekend, with the lieutenant governor, the governor, and Dr. Stack. It was believed that amount of time would be sufficient to allow the virus to calm down, for lack of a better term, to get to a place where we think that our reopening plans could be successful, to allow hopefully that the masking, the more we see people masking around the state, continuing would hopefully start reducing the number. And so that I don't have a metric of how September 28th was arrived at, other than we need time. And the governor has talked about we need sufficient amount of time to see to get out of the situation that we're in with an increasing community spread across the state, and at the positivity rate above 5%. And then the other part of the question, Tony, and then, or go ahead, Dr. Meserly.
This is Connie. I think if you look at the bar graph that's been shown at some of the press conferences, and you can see where in July those numbers were going up like they were, and the bar graph is looking at total number of cases in 1 week, and that gets rid of your daily fluctuations. But they were looking, each bar was the number of cases each week in July and into August. And you can see that from 1 week to the next, we increased by almost a 50% increase, which was pretty frightening to us as a department. Once the mask mandate began, and as people started doing that, you saw that the increase from 1 week to the next went up 4%, went up 5%, and then last week, not this week, but last week actually went down a small bit. And so I think they were trying to extrapolate if we continue to have that decline, and we want to start school when we're in a decline with our cases. not when we're on the way up and just beginning to plateau. So I was not in the room when that decision was made, but I'm sure that was a mathematical extrapolation. They felt like that by the 28th we would see that downward trend and would feel safer about opening schools then.
Okay. All right. Thank you, Dr. White and Commissioner Brown. The next question we have, and this is, I'm going to read it just the way it says. This is a question I posed today to my state senator, but from the Department of Education and the Department for Public Health perspective, in quote, what exactly are you asking local school boards to do? End quote. You have the data, you see the rise in cases, you share information and establish guidelines. What do you really believe should happen?
Well, related to the issue at hand over that's causing some controversy around the state over the whether or not districts are going to follow the recommendation of the governor, my expectation, what I'm asking local boards of education to do as the chief state school officer and the interim commissioner of education is to use your position of authority to make responsible decisions based upon the expert guidance from those at the state level, and I'm talking about the people at public health. To make the decision to delay in-person classes based on that guidance, based on that expertise. That's my expectation. Having said that, we recognize that is a local decision. And while I believe we should have 171 districts that are using that position of authority to make a responsible decision to abide by the recommendation, I also know and already know that we're not going to unfortunately achieve that. I also know from talking to districts about the sincerity of their beliefs in justifying why they're not abiding by the governor's recommendation. I agree with the concern about getting back to school as soon as possible, and no, but that is not in dispute. I think where the disagreement is about a statewide effort that we think is needed for everyone to act in concert as a Commonwealth so that we can get it under control and we can all get back to a semblance of a normal life and get back to in-person classes and remain in in-person classes. I think that's the difference.
Okay. The next question, they're just wanting to know what are the limitations on the federal level that would help local school boards if rectified with COVID-19 and reopening schools.
Well, this is something we could probably spend the rest of the time, if not go till 9 or 10 o'clock and go to every member here on the leadership from KDE to talk about that because it impacts every district. I would say number one, we need some version of the CARES Act to be another version of that for additional federal funds to support the efforts that you're making at the local level to implement virtual learning, to expand those hotspots, to buy the additional Chromebooks, to buy the additional more expensive chemicals that you're having to buy for sanitation, all the expenses you're incurring. It's one of the first things. Robin, others, I would ask you to chime in.
Commissioner Brown, I think you're exactly right. One of the main things that we need addressed is to make sure that districts are adequately financially prepared to take care of this coronavirus pandemic and the impact that it's having on their districts and their communities. The CARES Act, the first round, of course, has been helpful, and we are appreciative, and districts are accessing and utilizing those funds. The hardest part, I think, from a funding perspective also is just understanding how long this is going to last. We're all trying to be very cautiously optimistic that if we can get through this next school year, we'll go back to what we call frequently now normal. But we don't know how long it's going to last. And as financial needs of districts roll on through this school year, I know that your superintendents and local school boards are concerned about the amount of funding that they have. So another round of funding would be very, very helpful from the federal level. We don't know what that's going to look like. And I know that we have been working and talking with our congressional delegation about the supports that we need. We hear from districts about concerns about funding for nutrition and food services and the hardship that that's placing. Districts really want to do the right thing and did a yeoman's task as we close down school, and they want to continue to provide those services. So, and you've already mentioned the PPE that is required, the sanitizing, the volume and frequency that need to increase along with the pandemic, the bus routes, all the different things that you all are juggling and wrestling with. And we really need the federal government to kind of step up and help with additional funding so that we can turn our focus off of the funding issue and just focus on keeping our kids safe and all the other issues that we've talked about tonight.
Sorry, I was muted there for a moment. Flipping to the next question. Just trying to go through and make sure. Okay, next one. Just a general question about why doesn't the Department of Health simply close all schools with an order if they are so fearful of students returning at this time?
Well, the Department for Public Health, the first thing that we always try to do is inform and feel like if we give people the right information and the right data, they'll make those kinds of informed decisions on their own. You're the educators. You're the ones that know your students and know your schools. And we feel like that's the decision that is made in conjunction with your department and your school boards. The Board of Education, the Department of Education, and we are here to try to be as much of a support and a partner in this as possible. But it is not something that we felt like it unless we were actually seeing cases and someone was not acting in good faith. That would not be a role that we would play. I'm probably not articulating that very well, Commissioner Brown.
No, I think you have, and also would just reiterate that it has been a partnership and continues to be a partnership with public health because public health, you are the experts in these matters, and sometimes we get isolated, and we do get isolated in silos in state government when things are in normal times. This is the time we work together. You're relying on our expertise in education to inform your decisions. We're relying on your expertise primarily because this is a public health crisis.
All right, another question. They were wanting to know, this is just a suggestion and they're just throwing it out there. They're wondering if labs couldn't share the information related to zip codes. They said their daughter has been tested twice and had to give a home address each time, not understanding why the information just can't be readily made available. I think, Dr. White, you said it's maybe an issue with the labs themselves not wanting to disclose, or?
Well, I mean, at the very beginning, we were lucky if we got a date of birth and the person's name, much less a zip code. And that makes it very difficult to contact trace if you don't know who this person is. So that made that whole process much more labor intensive. I will say that laboratories and providers are giving us better information as we process through this. We're helping make those processes more user-friendly. People are understanding that this data is absolutely critical for you and for many, many other people in the state as they're making some tremendous decisions on moving forward during this pandemic. The pandemic is not over, and we need to continue to be sure that we're providing with the best data that we can. So, yes, we're going to ask that just to be sure that the Mary Jones that got a test done last week is the same Mary Jones that got a test done this week, so we don't count something twice. We do a lot of work to try to be sure that these are not duplicates, and we want more than just name and date of birth. We'd like address. We'd like as much information so we can cross-check that and be sure this is or is not the same person.
Okay. And Dr. White, while you're on, I know that there was an issue, or there was something that came out today about the vaping and the COVID numbers and students. Did you want to?
If you're looking to open your school, whenever that is, please start to put some emphasis on vaping. A study with over 4,000 students found that the students that were vaping were 5 times more likely to get a COVID illness when they were exposed. And if they vaped and smoked traditional cigarettes at the same time, that was almost 7 times more likely. So this would be an excellent opportunity to use to just inform the kids about vaping. And yes, there are consequences from vaping, and COVID has really highlighted that.
Okay. The next question, why are the after-school care programs still opening even if the schools are not going in person? I'm not sure if that's within our purview or if we need to flag that one.
This is Kelly. I can say that we have asked, our legal team right now is looking at some information around child care programs, and we have many school districts that run their own child care program after school, and then we also have some outside agencies that run child care programs in school buildings. But at this point, as long as they are following, and Dr. White, you confirm this for me, but as long as they're following the child care guidance documents that were released back in June, I think everybody's okay with that.
That's correct. And Dr. Meserly can back me up on that. She spent more time with that than I have.
Okay. All right. So just
yes.
Oh, go ahead.
Yes, on the child care, anything that is planning to stay open has to follow the current guidelines, and I believe that those are limited to groups of 10 currently.
All right. Thank you. All right. So I'm just doing a quick check on the time. It is 7:30 Eastern time. And I believe that we have gotten through approximately, there's, I would say probably about 30 to 35 questions. We have a few more left. Some of them are repetitive. And I just wanted to check in with the commissioner to see how you wanted to proceed.
Yeah, we indicated at the beginning we would hold to 7:30. I know others have, folks may have other plans or meetings that they need to get to, particularly in the Central Time Zone region. We will add the questions we did not answer through to the yellow sheet, which is the huge question and answer document. We can send that link to KSBA in the future for so that you know where that document is. I want to thank again our friends at Public Health, Dr. White, Dr. Meserly. I know it's always a long day for you when you all get started over there very early in your meetings. Also, I want to thank the Lieutenant Governor for stopping in, and we appreciate that. And then finally, I want to thank the Kentucky School Boards Association and Carrie. Thank you for facilitating the town hall today. Local board members, I want to thank you. You've provided excellent questions. And I understand the stress you're under. Many of you may know that I'm the son of a local board member. At least at one time, my dad was on a local board of education for 32 years, and he still talks about that's one of the most rewarding experiences of his life. However, I can remember on numerous occasions I could see the stress, anxiety, and the concern on his face. Because of the many issues faced by a local board of education, and that was not during a pandemic. So I'm telling you that because I understand what you go through, the thought process you go through. That doesn't always mean we agree at the state level and the local level, but I want you to know we understand that. We know there are times that you feel defeated, that many of you, and I think some of the questions alluded to this, you may feel like all the planning you've done is out the window because we're asking you to follow this recommendation. But I need you to know that the planning is very important and that you will be utilizing it in September and through the rest of the year. when we get back to in-person classes, and that's something we all are looking forward to. It's going to take all of us, though, working together as a state, as a commonwealth, and I believe in the meaning of that word, and I do believe we are different because we are a commonwealth, working together to get this under control. So please continue doing the hard work you're doing. Please continue to evaluate your plans and base your decisions on the data. And as I say at the other webcast, we'll see you online. Thank you for all the work you're doing. Take care.